afternoon, everyone. My name is Alicia Elias. I am here with Stilly Valley Health Connections. I want to thank you for joining us for a Lunch and Learn series with the Washington Poison Center. For everyone joining us live, please note that this class is set up as a Zoom webinar. This means that all participants are muted and your videos are turned off so that we can record the presentation. If you would like to leave any questions or comments, we encourage you to do so by using the chat or the QA box at the bottom of your screen. Thank you all for being here, and thank you to everyone who's joined us thus far. Now I'll pass it over to Alex, who'll be presenting today's topic. Thank you.
Perfect. Thank you, Alicia. Well, hello, everyone. Thank you all so much for being here, either live or in the future watching the recording. I have both the chat box and the Q&A box open, so please feel free to ask questions anytime. I'll do my best to answer those as they come in. There may be some I hold on to a certain portion of the webinar today, but definitely ask them anytime, and I'll do my best to get to all of them as I can. If you did not look at the description of what we're talking about today, it is this right here. We're going to talk about Kratom and 7-OH. If you don't know what 7-OH is, that is okay. We're going to go through it soon. Before I do, though, I have to talk a bit about the Washington Poison Center. So I hope you all have heard of the Washington Poison Center or any poison center, poison control. You know, we all serve the same purpose. We all share the same poison helpline. But in case we're a brand new concept to you, I'm going to walk through what we do a little bit. So this is our mission statement here: to prevent and reduce harm from poisoning through expertise, collaboration, and education. And I like to share this because we're really all about prevention and harm reduction and treatment. And we love, doing that with folks wherever we can. We love sharing our expertise. We love collaborating. We love providing education. So you're going to hear me talk about poison. Anytime I present on anything with the Poison Center, I have to talk a bit about poison and what do we mean with this term poison. I think a lot of folks think of this term and they have some very specific ideas about it. For us, we take a very, very broad approach to the term poison. For us, anything, any product or substance that could be harmful if it's used in the wrong way by the wrong person or in the wrong amount, that's what we would call it. So that's a pretty big, broad definition that includes household products and plants and cleaners, bites and stings from insects and critters, as well as the medications, if we use them incorrectly, can be very, very, very harmful. Now, you can call the poison helpline. I'm going to show that number on the next slide, but you can call that number with any questions or emergencies about potential poisons. You can call about yourself. You can call about someone else. I want to emphasize it does not have to be an emergency. So say you have a new medication. You want to make sure it's safe to take with the supplement you're on. It's later at night. Your doctor's office is closed for the day. We're open 24/7. Give us a call. We love preventing that kind of thing from happening if we can. Now, if you ignore everything else I tell you today, please don't ignore this. If you have a phone on your person in this very moment, please add this phone number to your phone, to your contact list in case you ever need to call us. 800-222-1222. This is that national poison helpline I was talking about. Now, this will route to one of 53 poison centers across the country. If you're in Washington or you have a Washington area code, you're most likely going to get a hold of the Washington Poison Center. It's okay if you get another region center. They can always transfer you if they have to. We are open all the time. You can call right now. You can call at 4 in the morning, and someone is going to answer that phone, specifically one of our very highly trained nurses or pharmacists or physicians will answer that number. To clarify, I am not a nurse, nor a pharmacist, nor a physician. I am not answering that phone. I talk about the phones, but I don't answer them. Now, we're completely free, so you're never going to get a bill. We're never going to ask about insurance or anything like that. We are also confidential, so your information is safe with us. The same laws that protect your privacy and your information at a doctor's office, at a hospital, those apply to us as well. We also have interpretation services. So if anyone you know prefers a language other than English, that is okay. We can pull an interpreter in, still a free service, into any of our phone calls. Now, a relatively new feature for the Washington Poison Center is our text line. Now, this is Washington specific. This is not a national number. 206-526-2121. You can text this line or you can go to our website We have an online chat feature you can use. Those are operated by those call takers, so the same nurses and pharmacists and physicians. Those lines are open 8 a.m. to 10 p.m. So the typical 800 number Poison Helpline, when you call, that's open 24/7. If you text or chat online, there are more limited hours. If you reach us, if you text or message outside of those hours, you're just going to get a prompt saying, "Hey, please give us a call." Um, Keep in mind the either texting or using the online chat feature. You're getting the same expertise, but it will take longer. It's typically much faster to speak over the phone than it is to message things out that way. So if it is a more complicated case, then there's a good chance our call takers are going to ask you to just give us a call. Now, who calls the Poison Center? A lot of folks from home, school, work, just living their lives, and something happens. That's anywhere from 75 to 80% of our calls. The other 20 to 25% of our calls actually come from healthcare facilities, hospitals, clinics, urgent cares, as well as paramedics and first responders arriving on scene to a situation. So I share this so that you know if you ever call the Poison Center yourself, you're getting the same expertise that the experts get when they contact us. Around half of our calls are generally involve kids under the age of 6, but we take calls for folks of any age. We get plenty of calls for teens, adults, and older adults as well. All right, now if you ever have to call, or excuse me, let me back up here. This chart is really just a breakdown when to call the poison helpline versus 911 versus 988. We basically encourage folks following a potential poison or overdose situation to call us before 911, providing the person they're calling for is responsive, they're breathing, they can communicate with you, they're conscious, they're alert. They are not having a seizure. But if we recommend in those cases, call us first because there's a good chance we can keep you home. But if the person you're calling for is not conscious, they're not responsive, they're not breathing, they are having a seizure, please do not call us first and call 911 first. Those are far more life-threatening emergencies and require much faster intervention. And of course, 988 is a national mental health crisis service, should you ever need that. All right, a little bit on Poison Center data because I'm going to share some of our data momentarily. Now, keep in mind, folks are not required to call us. So when I share any sort of trend on any substance in any age group, it's going to be an underrepresentation of the number of exposures or the number of cases involving a specific product or substance in the state of Washington. So changes in our data can happen for a lot of reasons. If we see an increase, it could mean that more folks are aware of poison centers. Could mean I'm doing my job really well, and more folks know, oh, I can call the poison center for this. Um, we could also see changes in our data in response to a change in access or awareness of a substance or of a product. For example, calls involving nicotine vape devices didn't happen in the 1990s because that tech didn't exist yet. So, of course, now that that tech does exist, we do get vape-related nicotine exposure calls. We also can see changes to our data in response to large-scale stressors or traumas. COVID is a great example of this. In 2020 and 2021, we saw a huge uptick in our calls involving cleaners, especially folks mixing cleaners. And then we also, whenever we can, whenever we become aware of a new product, we try to update our database coding. So that can change our data as well. Now, keep in mind, our data generally represents short-term things, not chronic or long-term things. So, for example, someone is most likely contacting us involving cannabis, for example, because they took too many edibles, not because they're looking for assistance in reducing their cannabis use overall. So keep that in mind. What our data shows is somewhat specific. You've heard me use the term exposures in cases. You'll also hear me use the term patients in calls as well. Calls and cases are not the same thing. One case can involve multiple calls. One of my examples for this is if I call on a Monday because I got a cleaner in my eye, and I call back later that Monday, multiple calls for that same issue to say, hey, my symptoms changed. That's multiple calls for one case. If I call later that week because I took too many edibles, if I call that Thursday because I took too many edibles, that is a separate case, even though it's me, the same caller. So keep that in mind. And then another, way of framing some of the, meanings of increased calls or changes in our calls. Folks generally call us when something bad has happened. They call us when they're worried they made a mistake, they're concerned about something, or like I said, something bad happened. They are not calling us because they had an amazing drug experience. No one is calling to say, "Wow, this kratom was awesome." So again, our data tells some unique stories. Now, here is some overview data of our 2025 cases. So, the Poison Center had over 53,000 total cases. Washington Poison Center specifically. This is all our state center data. And just looking at some of these common substances, acetaminophen, we had over 3,700 cases. Ibuprofen, around 1,700. Diphenhydramine or Benadryl, around 1,300 cases, and so on and so forth. Compare that to cannabis at under 600 cases, nicotine just over 500 cases, and kratom just over 90 cases. Now, I do not share this to say we don't care about cannabis or nicotine or kratom or anything like that. I do share this to build some context, just to show we are not getting cannabis, nicotine, kratom, and a lot of these other substances nearly to the same volume as we are some of those more accessible products, acetaminophen and ibuprofen being some of the most common because they are over the counter, because they're so accessible. So just keep that framing in mind as we go through this. So I have alluded to kratom a couple times already here. So what the heck is it? Let's dive in. Kratom first is a plant, Metragenous speciosa. This is a plant native to Southeastern Asia. There's a lot of historic use in Thailand, Malaysia, Myanmar, and other countries in that area. Now, it has a bunch of things in it. This plant, this leaf has a lot in it, including some psychoactive components or alkaloids. One of the common ones is something called metragenine. Now, on its own, it's kind of strange. It lands on some of the same receptors as opioids and opiates, but different ones as well. And it doesn't seem to lead to the same kind of response as an opiate or an opioid, always at least. So it seems to be a lot less potent than something such as morphine. But then there's also this naturally occurring 7-OH or 7-hydroxymetragenine. Now, this on its own, especially when it's concentrated, is much more potent than morphine, and it does act like an opioid. So let's dive into that a little more. The estimates we come across a lot of the times is that 7-OH is anywhere from 10 to 13 times more potent than morphine. In that naturally occurring leaf version of kratom, it accounts for less than 2% of the total alkaloid content in the plant itself. On its own, though, it does bind to opioid receptors. So, with enough of it, it can cause respiratory depression, which means it can disrupt our ability to breathe. And it can potentially cause fatal overdose because of that disruption to our ability to breathe. Keep in mind, naloxone does work to reverse respiratory depression from kratom or 7-OH. So if you have naloxone on your person and you suspect that an opioid overdose is occurring, don't stop and try to determine, is it kratom or is it fentanyl or is it morphine? It doesn't matter. Please call 911 and administer that naloxone if you have it. Now, 7-OH, like I said, it's found in that leaf kratom, and folks have figured out how to synthesize it. Now, let's talk a little bit about opiates. and opioids in general. So, an opiate, for those who love technical definitions, is any drug that is derived from a more natural source, such as opium or the poppy plant. Um, we'll go through examples in a moment. Opioids are at least somewhat synthetic. There's tinkering that happens in a lab, at least to some level. Now, semi-synthetic opioids, they are derived from an opiate, and fully synthetic opioids are completely made in a lab. All of these, opiates and opioids alike, attach to the same parts of the brain and body. They cause the same kinds of responses, including the potential for respiratory depression, including potential for pain relief. And they have different levels of severity. They sometimes, some of them last longer than others, but they all have the potential for overdose. Oh, I don't know why it jumped around like that. Apologies, folks. But listing some of the specific examples here for opiates, we get morphine and codeine and heroin. These are all, more natural. They're not tinkered with in the same way in a lab as their opioid counterparts. And recently, I added to this list, kratom could be considered an opiate, excuse me, both mitragynine as well as 7-OH. The semi-synthetic opioids, for example, we can see oxycodone, hydrocodone, and then fully synthetic opioids, methadone, fentanyl, tramadol, and I have added kratom, specifically synthesized 7-OH. So there are a lot of folks who used to not really determine or see kratom as an opiate or opioid because it doesn't come from the same sources as other opiates and opioids do, and we are seeing some of those overlaps, some of the overlap in effects. Now, leaf kratom, this is just leaf kratom. This is not synthesized stuff. In low doses, 1 to 5 grams, folks have reported stimulant-like effects. It means it can kind of speed things up in the body. In higher doses, 5 to 15 grams, folks who have used this have reported opioid-like effects. They can see things kind of slow down a little bit. Higher dose use, especially a prolonged higher dose use, starts to become associated with dependence, so developing that physical dependence and potentially that addiction, that kind of use disorder, fewer desirable effects, and withdrawal symptoms as folks wean themselves off or reduce their use. Now, some clinical effects of kratom and 7-OH. This list here I pulled from Washington Poison Center cases. Of those 93 cases, these were the symptoms that we saw, the most common symptoms we saw. Starting at the top, we saw agitation. We saw tachycardia, that is a change in heart rhythm, an elevated heart rate. Hypertension, that's high blood pressure. A lot of GI issues, vomiting and nausea. Now we're getting into the less common symptoms here, at least from reports to the Poison Center. Some cases of hyperventilation, excessive sweating, and tremors. And then in just a few cases, folks reported hallucinations and seizures. Now, for folks who love doing literature dives and diving into publications, there are some really interesting ones on Kratom, and I'm referencing two of them here, kind of combining them. Pardon me, one was a study that was a huge survey done in Malaysia. And they surveyed folks who reported using kratom at these different levels, got a bunch of information that way. The other was a Reddit study, a really fascinating Reddit study where folks um, analyzed responses in the Kratom subreddit and they kind of gathered and consolidated all that information to come up with some overview statistics and statements. A really, really interesting study. So looking at both of those studies, some of the common symptoms or clinical effects folks reported. Apathy. There was a lot of apathy, or just feeling like you're not caring about something. Nausea and vomiting, so GI issues, decreased libido. came up, irritability, lethargy, feeling really tired, really sleepy. Weight loss was reported. Some folks experienced hyperpigmentation, dehydration, constipation. And for anyone who's ever been on, a prescription opiate or opioid following a surgery or something like that, dehydration and constipation are pretty common side effects. Now, a little bit of poison center kratom and 7-OH trend data. Now, this very first graph here, this is looking at national cases. So this is all poison centers across the country consolidating their info. So this is going back to from January to 2016 through July of last year, 2025. Every dot you see represents a month, number of cases in a month. So back in 2016, nationally, we saw fewer than 50 cases. This started, slowly increasing to, 2021, we see a bit over 150 cases nationally in that month there in May, about 150 cases a month. And then we do see it kind of maintains at or below 150 cases a month until 2025. And we do see some pretty sharp increases. Again, nationally, this is fewer than 350 cases as of last year. And we do like to pay attention when we see that kind of percent increase. Looking at the Washington Poison Center specifically, so this is going back to 2017. That's as far back as I could pull our data. We had around 20 cases, and we saw some increases and decreases. But from 2024 to 2025, we jumped from 54 cases to 93 cases. The 7-OH code, that 7-hydroxymetragenine code, was introduced in 2025. So in 2024 and earlier, we could have had 7-OH cases that we just didn't capture because we didn't have the ability to do so yet. Breaking down kratom versus 7-OH for 2025, we had 72 general kratom cases and 23 reported 7-OH cases. Folks who are really quick at math may be saying, Alex, that's 72 and 23. That's more than 93 because some of these cases reported both. There were a handful that reported both. Okay, let's see here. Now we're looking at kratom and 7-OH cases by age. This is 2024 and 2025 Washington Poison Center data. So we saw some cases in little kids, 0 to 5, one in 2025 for 6 to 12-year-olds. For teenagers, we saw 4 in 2024, 2 in 2025. So we do see some exposures with kids, but not nearly as many as we do with adults. A lot of the times, too, those little kid exposures, a 2-year-old is not seeking out kratom because they want to bring on opioid-like effects. They will put something in their mouth because they're curious. They want to know what it is. They think it's a piece of candy. So that we can often attribute that to, things may not have been stored very safely in the home or something like that. With adults, though, we'll go into caller reasons in a couple slides. But it is interesting to me, this 30 to 39-year-old range, we see a jump from 8 cases in 2024 up to 29 cases in 2025. We see other jumps in these other adult age groups as well. Now, this is looking at kratom and 7-OH cases by caller site. HCF means healthcare facility. So that's the blue figure there. We're comparing 2024 to 2025. In both years, we had more healthcare facility kratom cases than folks calling from home with a kratom exposure. Oh, and I should have said on this slide too, typically when a healthcare facility is calling us, it's because, well, it could be for a number of reasons, but it's often for more complicated kinds of exposures or for substances that clinic, that emergency department doesn't see very often. So they're contacting us for some additional oversight because it's something they may not be as used to. Which makes sense with kratom because we don't have as many numbers compared to so many other substances. And looking at Kratom and 7-OH cases by reason. Now, this is not all possible reasons that someone might call the poison center, including for Kratom, but this is showing the two most common reasons in 2025 specifically, and then comparing that to 2024. Now, this first category here, intentional abuse. I do want to take a moment to unpack this term abuse. This is a stigmatizing term when we're talking about drugs and substances. Drug abuse and substance abuse can carry a lot of weight, a lot of stigma with it. And I show it here because Poison Center data still has this embedded as a code. And what this means in a Poison Center context is that the individual, the patient, was seeking some form of psychoactive effect or some form of intoxication. And then something went wrong. And then this other category, other withdrawal. This means that folks were contacting us. Most of these cases, or I think all of these cases actually, were actually coming from healthcare facilities. So folks were going through kratom withdrawal effects and were admitted to the hospital, and the hospital was contacting us for how they should manage and treat those withdrawal symptoms. Now, something that's, this is getting really deep into our data. This is one of the last data slides, so bear with me here. In 2025, when we look at all substances for the Washington Poison Center, we received 62 withdrawal cases. We helped with 62 withdrawal cases total of all substances. That means that kratom represented 17 out of 62 total withdrawal cases. Really interesting to me. And when I looked at that data, the next most common substance involved with withdrawal cases was or were benzodiazepines, which do have incredibly intense withdrawal symptoms. So that just stood out as rather interesting to me that even though there are relatively few total withdrawal cases and relatively few total kratom cases that the Poison Center gets involved in, kratom represents a rather significant proportion of the withdrawal cases we do help out with. It's about 27% of those cases. Okay, now stepping out of our data, we're looking at why folks report that they use kratom. And this is based largely off of those two studies. I referenced the Malaysian study and that Reddit study. So the Malaysian study found that folks reported that, they sought out kratom to feel good, for euphoria. To try to decrease addiction to other drugs, to interact with and enhance other drugs, that it was often more accessible, more affordable than something like heroin, some other opiate. And a lot of folks reported that they used kratom to try to deal with opioid withdrawal effects. The 2020, or excuse me, the 2019-2020 Reddit study showed some overlapping, but some different reasons for use as well. A lot of self-treatment, a lot of self-treatment of pain or anxiety, depression, substance use disorder as well, so addiction and withdrawal. And then, also overlapping, there was a lot of self-reported mood enhancement, or enhancement of energy, alertness, analgesia, or pain relief, as well as relaxation. Now, not our Reddit study, the Reddit study, pardon me, also looked at what we call polysubstance use. That's using multiple substances at once. Over half of the Reddit posts described polysubstance use with kratom and stimulants or opioids, hallucinogenics, benzodiazepines, cannabis, and others. About a third of poison center kratom cases seem to be polysubstance or are reported as polysubstance. Now, a bit of dive, I guess, a bit of an overview into some marketing and legality that we see with Kratom. Interesting marketing stuff. So this is from a social media post. This is in Massachusetts, not in Washington, but it's from a brand that we do see nationally, that we have seen in Washington, called Feel Free. And I just put this here because a lot of the language is very interesting to me. Got description of ancient plants, of non-alcoholics, of trying to market to an audience that is trying to abstain from alcohol, trying to stay sober. Used for centuries, a lot of historic use. It's citing helps with anxiety. Really don't have the data to say that. Um, we see a lot of online product examples as well. There are gummies and powders and energy shots, tablets, and all these different formulations here. There's even apparently a 70H vape, disposable vape there. Now, legality on Kratom is kind of bizarre right now. It is not scheduled, though there are talks of scheduling it nationally, at least temporarily. Um, it's not regulated in Washington, and it is still showing up. It's still popping up in like corner stores and gas stations, smoke shops as well as online markets. Now, there is no regulatory body to say, oh, this is a proper serving size of kratom. So keep that in mind. But even with that, even without that regulatory body, this particular product, I know this is very fuzzy writing here. This particular product, it's a kind of one of those energy shots, but that has 70H. This is allegedly a six-serving bottle. And poison centers really like to pay attention to dose and measurement tools. Um, uh, and I don't know of anyone who would take an energy shot and portion it out into six portions that way. This is another one where every single tablet here is considered four servings. So one dose would be 1/4 of a tablet. Like I said a moment ago here, Kratom legality, 7OH legality is very, very strange. It's technically not legally not allowed to be on the market, but it is still unscheduled. There are a number of local jurisdictions in Washington that this last year banned it entirely. So Spokane Valley, Cle Elum, Othello. There were a number of Washington bills this last legislative session. Some tried to regulate kratom to build age limits and dosing limits and that kind of thing. There were other attempts to fully ban it. Those didn't really go anywhere this last year, but I expect this next year that we will see more of those bills on the table. Now, I kept slides a little shorter this round because I wanted to leave a lot of extra time for questions. But you folks, that's it. That was what I had prepared for you this afternoon. I'm happy to jump back to any slide. I'm happy to answer any questions as I can. Um, like I said earlier, I'm not a clinician. I'm not a pharmacist, a nurse physician. So I can't give you direct treatment advice at all. So if you have questions like that, I'm going to tell you to call the Poison Center. But if you have any questions on any of the graphs, any of the data here, let me know. And I'll do my best to answer. All right. Well, I'm not seeing an explosion in the chat box or the Q&A box. So, Alicia, do you have any questions or points? Oh, hey, there we go. I do see a question in here. Do you know how 7OH is being synthesized? What is the lab source, if not from plants? I'm not positive specifically. I can't really speak to the chemistry involved in how folks are synthesizing. That's a great question, though. It's something I'll have to ask my uh, directors about. Thank you for asking that.
Okay, well, if you have any lingering questions, feel free to put them in the chat box or the Q&A box. But thank you to everyone who joined us for this class. If you're interested in joining us next time with the Washington Poison Center, the Lunch and Learn session will focus on older adults and the short and long-term health correlations with cannabis use. Cannabis 101 Evidence and Considerations for Older Adults will be held on Wednesday, September 2nd from 12 p.m. to 1 p.m. You can find registration on the Stilly Valley Health Connections website. As you're leaving today's webinar, there will be a quick 6-question survey that will appear on your screen. We would love it if you could take a minute to let us know what you thought of this class and to share any feedback or suggestions for future classes. That is all that we have for now, but thank you all again for attending, and we hope to see you at future classes.
Thanks, everyone.